Welcome back to the YouTube channel Breastfeeding Nurtured All You Need to Know. In our last session, we explored common breast challenges mothers may face during breastfeeding and practical strategies for managing these conditions. Today, in session 6, Breastfeeding, Navigating Refusal and Excessive Crying, we will address common challenges when a baby refuses to breastfeed or cries excessively. We will also learn practical strategies to manage these situations and understand the underlying causes, helping to ensure a smooth breastfeeding experience for both mother and baby. Let's start with our first slide. Understanding and managing breastfeeding refusal. What are the learning outcomes? Upon completing this session, we will be able to recognize the potential reasons for a baby refusing to breastfeed, analyze the specific factors contributing to breastfeeding refusal in individual cases. Then we will outline the effective approaches to address and resolve breastfeeding refusal issues. The causes and management of excessive crying will be discussed later in this session. When we talk about reasons for breastfeeding refusals, these can be broadly classified into four major categories. First is the health related issues such as illness, discomfort, or sedation, which are common in the first week and can interfere with the baby's ability to breastfeed. Challenges with breastfeeding technique, particularly related to attachment and positioning, often arise in the initial months and may discourage the baby from feeding properly. Next, emotional or environmental disturbances, including changes in the baby's environment, emotional state, or routine, especially during the later months, can also lead to breastfeeding refusal. Last but not the least, behavior that mimics refusal may seem like rejection of breastfeeding, but is actually part of normal development or the natural weaning process. In the following slides, we will be discussing these categories separately. Let us now discuss in detail the possible reasons for the baby's breastfeeding refusal. There are several health-related factors that may cause a baby to refuse breastfeeding, especially in the early days after birth. Babies who suffer from any illness due to difficult birth or infection may struggle with breastfeeding. They may have trouble attaching to the breast or breastfeed less frequently. Weakness from malnutrition, preterm babies, low birth weight babies can also lead to breastfeeding challenges. A baby with a sore spot such as a bruise from delivery may experience discomfort or pain while breastfeeding. They may cry or resist feeding if their mother unintentionally presses on the painful area. Some sedative medication taken by the mother during labor or for medical conditions like epilepsy can cause the baby to become overly sleepy, thereby reducing their interest in breastfeeding. Other contributing factors like a blocked nose may cause the baby to pause frequently to breathe during feeding. Oral discomfort from conditions like thrush or teething may lead to the baby refusing to nurse after a few attempts. These factors no doubt can influence a baby's breastfeeding behavior, thereby requiring support and care for both mother and the child. Another major category of reasons for refusal to breastfeed is the challenges with the breastfeeding technique, which is particularly related to attachment and positioning, often arise in the initial months and may discourage the baby from feeding properly. In the first month or two of a baby's life, some challenges can make breastfeeding difficult or unpleasant, leading babies to pull away from the breast out of frustration. Let's explore the common causes behind these issues. Early separation of mother and baby after delivery can disrupt the natural breastfeeding process, making it harder for the baby to establish a consistent feeding routine. Introducing or use of bottles or pacifiers too early can cause nipple confusion, where the baby struggles to switch between the bottle feeding and breastfeeding, leading to frustration at the breast. If a baby is not properly attached to the breast, they may not receive enough milk, leading to refusal or frustration. Sometimes the baby may reject one breast more than the other due to difficulties with attachment on that side. Incorrect positioning, such as applying pressure to the back of the baby's head, can cause the baby to resist breastfeeding. If the mother's milk is slow to come in, or if the breasts become engorged, the baby may struggle to get enough milk, leading to frustration and refusal. When the mother has an oversupply of milk, the flow may be too fast for the baby to manage, causing them to choke, cry, or come off the breast after just a minute of feeding. This can also lead to difficulty in suckling and swallowing coordination. Mothers' actions during feeding, like shaking the breast continuously or restricting the length of feeds, can disrupt the baby's ability to nurse effectively, contributing to breastfeeding difficulties. We will see later how understanding these causes and adjusting techniques or practices can help make breastfeeding more comfortable and successful for both mother and the baby. Babies are sensitive to changes in their environment and disruptions, thereby leading to breastfeeding refusal. Even without crying, a baby may reject the breast, particularly between the ages of 3 and 12 months. This sudden refusal to breastfeeding is sometimes referred to as a nursing strike. Here are some of the common reasons why an infant might refuse to breastfeed due to emotional or environmental disturbances. When separated from the mother, in cases where mother begins working outside the home or is away for extended periods, the baby may feel unsettled and refuse to breastfeed. Sudden shift to the new or multiple caregivers, or the presence of too many different carers, can cause stress for the baby, leading to breastfeeding challenges. Changes in family routine, like moving to a new house or visiting relatives, can disrupt the baby's sense of security, causing them to refuse breastfeeding. In case the mother is ill or has mastitis, the milk may taste different, such as becoming saltier, which can cause the baby to stop breastfeeding. Even mother's menstruation may alter the mother's milk taste, which could lead to baby to refuse to breastfeed. Changes in the mother's scent, which could be due to using a new soap, perfume, or consuming different foods, can confuse or unsettle the baby, affecting their willingness to breastfeed. These changes, although often temporary, can impact breastfeeding and may require patience and support to help the baby return to their normal feeding routine. Sometimes a baby's behavior may appear as if they are refusing to breastfeed, but it is not genuine refusal. Instead, the baby may be reacting to various changes or external factors that can temporarily affect their feeding patterns. How do we know whether it is apparent and not real refusal, but is actually a normal baby behavior? This can lead to confusion for mothers, as they may perceive it as the baby rejecting breastfeeding when in reality the baby is not refusing at all. Here are some common scenarios where this occurs. Normal rooting behavior in newborns, when he searches for the breast, often move their head from the side to side. This motion might look like the baby is shaking their head and saying no, but it is simply part of their natural rooting reflex, which helps them find the nipple and latch on to feed. Distractions in babies aged 4 to 8 months by their surroundings is quite common. They may pause or stop suckling when they hear a sound or see something interesting. This behavior does not indicate refusal, but rather reflects their growing awareness and alertness. Some babies gradually wean from breast around the age of 1 year. This process is not sudden but typically gradual, with the baby reducing the frequency of breastfeeding sessions on their own. This self-led weaning should not be mistaken for outright refusal, as it is a normal part of development. In all these cases, what appears to be refusal is often just a normal aspect of baby behavior or development. When a baby refuses to breastfeed, several strategies can help address the situation and encourage a return to breastfeeding. Let's now try to identify and address the underlying causes. In case of illness, if the baby struggles to attach and suckle, they may require special care in a hospital setting. Infections should be treated with appropriate medications, or else the baby should be referred to a specialist if necessary. The mother can express her breast milk for feeding through a cup or tube until the baby is able to breastfeed again. In case of pain, assist the mother in finding a comfortable position for holding the baby that avoids putting pressure on any painful areas. Continuing with the identifying and resolving the underlying cause, address sedation in the baby. If the mother is on regular medication, consider exploring alternative options and provide extra support until the effects of labor analgesics wear off. For breastfeeding difficulties, discuss the reasons behind the difficulties with the mother and teach her how to express her milk. When the baby is willing to breastfeed again, assist the mother in improving her technique and building up her milk supply. In cases of oversupply, recommend that the mother express some milk before offering the breast to manage the flow. Suggest using scissor hold to slow the milk flow or breastfeeding while lying down. Encourage her to let the baby feed from only one breast during each session. We will be discussing oversupply later in the session as well. Continuing further, to identify and resolve the underlying cause that may upset the baby. This can include minimizing separation and disruptions to the baby's routine wherever possible. Additionally, mothers should consider discontinuing new soaps, perfumes, or foods that may alter the mother's scent. Apparent refusal can be resolved by explaining to the mother the normal behavior of the baby. If the baby is rooting, explain that this behavior is normal and encourage the mother to let the baby explore the nipple. If the baby is easily distracted, recommend feeding in a quieter environment as this behavior usually passes. If self-weaning appears to be happening, suggest mother to ensure that the child is eating enough solid foods, providing additional attention and co-sleeping to facilitate night feeds. Advise mother to express breast milk for cup feeding. This is valuable at least to the age of 2 years. Continue to identify and address any illness that may upset the baby. For a mother-baby pair affected by thrush, both should be treated appropriately with gentian violet or nystatin, applied locally, and oral medication if needed, as discussed in the previous session. We have already discussed about it. For teething, advise the mother to be patient and continue offering the breast to her baby. For blocked nose, the mother need to be taught how to clear the blockage and suggest shorter, more frequent feeding sessions. Once the underlying cause for refusal to breastfeed is identified and addressed, the mother and the baby should be supported in re-establishing a positive breastfeeding experience, which at times can be challenging. However, it's possible by offering support and proper guidance with patience to both the mother and the baby. To resume breastfeeding comfortably, the mother needs emotional support to reconnect with her baby and rediscover the joy of breastfeeding. Building her confidence and providing consistent encouragement are essential for a smooth transition back to breastfeeding. Remember that breastfeeding cannot be forced and it may take time for the baby to resume feeding comfortably. Let's go through the steps to support the mother for developing a positive breastfeeding experience. Encourage the mother to keep her baby as near as possible to her. Skin to skin contact can enhance bonding and support breastfeeding readiness. Family members such as grandmothers or other helpers can assist by taking on household chores and caring for older children, allowing the mother to focus on her baby. The mother should hold her baby frequently, not just during feeding times, and sleep close to the baby for continued connection. Encourage the mother to rest and relax. If the mother is employed, encourage her to take time off work if possible, including sick leave, to focus on breastfeeding. Discuss the situation with the baby's father, grandparents, or other supportive individuals to ensure that the mother receives the help she needs. The mother needs to offer the breast gently. She should allow the baby to approach breastfeeding at their own pace. Encourage the mother to offer the breast when the baby shows interest, especially when they are sleepy or after cup feed. Suggest trying different feeding positions to find what works best and recommend offering the breast when the mother feels her milk ejection reflex or letdown beginning. To succeed, mother needs consistent encouragement while offering support. Now that we have covered how to support the mother, let's focus on how we can assist the baby in returning to breastfeeding comfortably. Express a few drops of breast milk into the baby's mouth to encourage feeding. This can help ease any frustration the baby might feel at the breast and encourage them to latch on more easily. Ensure that the baby is positioned properly to make attachment to the breast easier. Skin to skin contact in reclining position allows the baby to naturally move towards the breast for feeding. Advise the mother to avoid pressing the baby's head or shaking her breast, as this may hinder the baby's natural feeding reflexes. Alternative feeding is required when the baby is not yet breastfeeding effectively. In such situation, the mother can express her milk and feed it to the baby by cup. This maintains her milk supply and keeps the baby nourished. Encourage the mother to express milk as often as the baby would normally feed to ensure the milk supply remains strong and her breast stays healthy. Use of bottles, teats, and pacifiers or dummies should be discouraged as they can interfere with the baby's ability to return to breastfeeding. By providing the mother with these tools and support, you help her regain confidence and create an environment where both she and her baby can rediscover the joy of breastfeeding. Although I have addressed the support needed for both the mother and the baby separately when dealing with breastfeeding refusal, it's important to remember that the mother and the baby function as a single interconnected unit. Their needs are closely linked and both must be supported together for successful breastfeeding. To summarize, here's an overview of the essential steps to help both the mother and the baby to resume breastfeeding comfortably. Keeping the baby close to the mother as much as possible, minimizing the need for other caregivers. Encourage frequent skin to skin contact, not only during feedings but throughout the day. Also suggests the mother to sleep near her baby to maintain closeness. Request assistance from family or friends for household tasks so that the mother can focus on her baby. If the mother is employed, encourage her to take leave to dedicate time to breastfeeding. Mother should offer the breast whenever the baby shows interest, especially when they are sleepy or after being fed by cup. Mother can try different feeding positions to find what works best for her. Mother should offer the breast when she feels her milk letdown reflex is activating. Assist the baby in taking the breast by expressing a little breast milk directly into the baby's mouth to encourage them to latch. Position the baby in a way that makes it easy for them to attach to the breast. As already said, mother should experiment with different positions. The mother should be taught how to breastfeed the baby while reclining with skin to skin contact for a natural feeding process. Advise the mother to avoid any pressure on the baby's head or shaking of the breast during feeding. Use cup feeding as an alternative. Mother should be helped to express breast milk regularly to maintain her supply and keep her breast healthy. She should feed the baby using the expressed breast milk with cup when possible and avoid giving artificial feeds. Use of bottles, teats or pacifiers should be avoided to prevent nipple confusion. Let's now discuss one of the common conditions where babies cry excessively without a clear reason, which is referred to as colic. This can be distressing for both the baby and parents. Crying often occurs at specific times, typically in the late afternoon or evening, and may last for several hours. The baby may pull up their legs towards their abdomen, which can appear as though they are experiencing pain or discomfort. Despite appearing hungry and wanting to breastfeed, the baby might be difficult to console during these crying episodes, making soothing efforts seem ineffective. The exact cause of colic is unclear, though it may be linked to an overly active gut or the presence of gas. In some cases, babies show a predictable pattern to their crying, which can help caregivers anticipate these episodes. Breastfeeding refusal is not uncommon during colic episodes, but it's important to note that colicky babies generally continue to grow and develop normally. Most babies with colic begin to show improvement, with the crying significantly decreasing around 3 months of age. Let's now explore additional common causes of crying in babies. Babies may cry a lot if they feel too hot or too cold, or they have pain due to condition like earache or colic, or are sick and have sepsis. When a baby is not properly attached to the breast, they may struggle to get enough milk during feedings. As a result, they may demand feed frequently and suckle for extended periods. Though the baby may still grow and receive sufficient milk by feeding often, they are often left unsatisfied and may continue to cry due to hunger. Improving breastfeeding techniques and ensuring proper attachment can help alleviate this issue. Babies often go through the periods of rapid growth, during which their hunger increases significantly. This usually occurs around 2 weeks, 6 weeks, and 3 months of age, but can happen at other times as well. During these growth spurts, baby may demand to feed much more often, leaving parents feeling like they are constantly feeding. After a few days of frequent feeding, the mother's milk supply usually increases, allowing the baby to return to a more regular feeding pattern. Oversupply of milk happens when a baby receive excessive amount of milk too quickly during feedings. Gastro-esophageal reflux occurs when milk and stomach acid flows back into the esophagus, causing discomfort and irritation. In this session, we will explore both of these conditions in detail shortly. In some cases, substances from the mother's diet pass into her breast milk and may cause discomfort or an allergic reaction in the baby. Common foods that might trigger a reaction including cow's milk, soya, eggs and peanuts. Baby can develop allergies to these proteins, causing them to cry more frequently. Mothers should not restrict their diet unless they notice a specific food consistently causing distress in the baby. Caffeine found in beverages like coffee, tea and colas can pass into the breast milk and affect the baby, leading to restlessness and increased crying. Smoking or usually other substances can also cause babies to cry more frequently. Secondhand smoke from the family members can similarly contribute to crying and discomfort in babies. Some babies naturally cry more and require constant holding, comfort and attention. These high needs babies tend to be soothed by close contact with their caregivers. In cultures where babies are routinely carried or kept close to their mothers, excessive crying is less common compared to those where babies are placed down more frequently or sleep separately. By recognizing these different causes of crying, caregivers can better understand their baby's needs and take appropriate actions to soothe and support them. Remember that hunger or diaper discomfort due to wet or soiled diapers, which can cause irritation, are common causes of crying. Understanding the causes of babies crying is crucial when offering support to families dealing with a fussy infant. By addressing common triggers and providing guidance, we can help caregivers manage these challenging moments more effectively. First, we need to identify the cause by engaging in active listening and encouraging the mothers to express her emotions. She may feel guilty or frustrated, and others might contribute to these feelings by offering unhelpful advice, such as using pacifiers or supplements. So, you need to take a detailed history first to understand the baby's feeding habits and general behavior. Ask about the mother's diet, including caffeine intake, smoke or drug use, and any pressures she may face from the family or others. Next, you need to assess breastfeeding and check the baby's attachment, positioning, and how long each feed lasts. Poor attachment may lead to frustration and crying. Examine the baby to ensure that the baby is healthy and not in pain, and assess the growth of the baby. If there's illness or discomfort, treat or refer as needed. The next essential focus is helping caregivers build confidence while offering them the support they need during challenging times. Acknowledge the mother's perspective, validate her thoughts about the cause of her baby's distress, accept her emotions regarding the baby's behavior. Praise what's being done right while reassure her that the baby is healthy and growing well. Emphasize that her milk is fully meeting the baby's nutritional needs and there's nothing wrong with either her milk or her ability to care for her baby. Let her know that her baby is not bad or naughty and does not need discipline. Provide useful information depending upon the cause, like explain that the baby may have colic or simply have high needs requiring extra comfort. Reassure her that the baby isn't sick but might experience genuine discomfort and that the crying will likely decrease by 3 to 4 months of age. Discourage the use of colic medications as they are no longer recommended and can be harmful. Inform her that supplemental feeds are unnecessary and may not improve the situation. Even formula-fed babies can develop colic or allergies to cow's milk. Encourage breastfeeding for comfort, but warn against the use of bottles and pacifiers as they are not safe alternatives. After fostering confidence in caregivers, the next step is to provide them with practical strategies to manage their baby's crying. Offering help suggestions to address crying not only reassures parents but also equips them with the tools to handle these challenging situations more effectively. Suggestions should be tailored on the identified cause of the crying, as these can vary across different cultures and regions. Encourage the mother to reduce her intake of caffeinated drinks like coffee, tea, or cola. If she smokes, suggest cutting back or stopping altogether. If she continues smoking, advise her to smoke only after breastfeeding, not before or during. Ask family members to refrain from smoking in the baby's presence, especially in the same room. Modify diet for potential allergies by suggesting the mother to eliminate cow's milk, dairy products, or other common allergens such as soya, peanuts, or eggs from her diet for a week. If the baby cries less, she should continue to avoid that food. If there is no improvement, she can reintroduce it into her diet. Avoid recommending diet changes if the mother's nutrition is already poor. Ensure she has alternative nutritious protein-rich options like beans to replace the eliminated foods. If oversupply of milk is suspected, advise the mother to allow the baby to nurse from only one breast per feeding, continuing until the baby finishes on their own. Explain that nursing longer on one breast allows the baby to get more hind milk, which is richer in fat. If reflux is suspected, recommend feeding the baby in an upright position. It may also help to prop the baby up while they sleep, rather than having them lie flat. Once caregivers feel more confident, the next priority is offering practical support to help them manage their baby's crying. Providing hands-on assistance and actionable advice empowers families to navigate these difficult moments with greater ease and assurance. Help the mother ensure that the baby is well attached to the breast. Improving attachment can positively affect the baby's behavior. Explain the comforting techniques like holding the baby close with gentle movement and light pressure on the abdomen to soothe a crying baby. Offer to demonstrate different ways to hold and carry the baby for comfort. We'll come to it shortly. Sometimes it can be beneficial for others to assist in soothing the baby, as the lack of breast milk scent may allow the baby to be more easily comforted by them. Help the baby burp by showing the mother how to bring up the baby's wind by holding them in an upright position, either sitting or against her shoulder. Emphasize that winding is not always necessary unless the baby has colic. Recommend skin to skin contact for babies under 1 month old and feeding in a reclining position to improve comfort and attachment. Engage with the mother's family by discussing with them the baby's needs to foster support and reduce stress. This can prevent unnecessary supplements and promote a more supportive environment for the mother and the baby. Now, building on the previous strategies to support a family with crying baby, let's now focus on specific techniques for holding and carrying the colicky baby. As I already said, these approaches help in providing comfort, reduce colic symptoms, and make it easier to calm the baby during distressing moments. It's important to remember that babies are most often comforted by gentle pressure on their abdomen, soft movements, and being held close. There are many ways to provide this comfort. In forearm hold, have the mother hold the baby along her forearm, using the other hand to gently press on the baby's back. This position provides support and closeness, helping the baby feel secure. Another way to support the baby is by holding the baby on the lap. Mother should sit comfortably, ensuring the baby's back is resting against her chest for proper support, as is shown in the picture. Hold the baby around the abdomen, applying gentle pressure to keep the baby secure and stable. Gently rock the baby forward and backward, maintaining a smooth and steady motion to soothe the baby. Ask the mother to use her chin to lightly support the baby's head, ensuring that the baby's head remains in a stable and safe position during the rocking motion. Yet another way is to hold the baby upright. This can be done by a male member, especially the father. This can provide a different perspective on soothing techniques. The father holds the baby upright against the chest, ensuring that the baby's head is positioned gently against his throat. This closeness creates a comforting environment for the baby. Gentle humming by the father is encouraged in this position. The deep sound of his voice can be very soothing for the baby, mimicking the comforting sensations that infants often respond to. This method combines closeness with calming sounds, making it an effective way to help soothe a colicky baby. We now understand that to effectively support a family with a frequently crying baby, it's important to address both practical and emotional aspects. This ensures that the mother feels understood and empowered to handle the situation. As already discussed, we can approach this under the following four key areas. Identify possible causes, provide emotional support, share reassuring information, and offer practical solutions. Now, before we conclude this session, let's take a moment to focus on two conditions yet often overlooked: gastro-esophageal reflux and breast milk oversupply. These are the challenges. These issues can significantly impact a baby's feeding comfort. While we have briefly mentioned them earlier, we will now delve into them in greater detail. Gastroesophageal reflux occurs when milk flows back from the stomach into the esophagus, causing discomfort for the baby. It becomes noticeable not before second or third week of life, when the baby's milk intake increases, peaking around 4 months. The regurgitation usually happens without much effort and tends to worsen after feeding, especially when the baby is lying down. Babies may spit up to 4 or more times a day. It is more common in tube-fed babies. Despite the frequent regurgitation, babies with gastroesophageal reflux generally feed well, grow normally, and show no other concerning symptoms. Symptoms tend to improve as the baby grows and the digestive system matures. Most infants have physiologic reflux with no clinical consequences, so there's nothing to be worried about. Another issue that can lead to feeding difficulties is the oversupply of breast milk. Loud gulping sound occurs when a baby swallows a large amount of milk at once. This can indicate that the baby is receiving a substantial flow of milk, which may be a sign of an oversupply from the mother. In some cases, this oversupply can lead to challenges with breastfeeding. Oversupply happens when a mother produces more milk than her baby needs, often due to a highly active oxytocin reflex and the production of large amounts of milk. Mothers may notice their breasts feel overly full, milk flows too quickly during feeds, and their baby may choke or pull away from the breast, sometimes refusing to continue feeding. Oversupply is common in the first month after delivery, before the milk supply adjusts to the baby's needs. It can also happen if the baby is switched between breasts too quickly or if the baby has poor attachment, causing ineffective feeding. With oversupply, babies may receive more fore milk, which is lower in fat, and less hind milk, leading to symptoms like colic, gas, loose stools, and sometimes green stools. Now, how to manage oversupply? To help regulate the milk supply, encourage the mother to offer only one breast per feed and allow the baby to finish feeding on that breast. She can offer alternate breast with each feed or feed from one breast for several hours before switching to the other. This helps slow milk production. Additionally, expressing a little milk before feeding, feeding while lying on her back or using a scissor hold can also slow the flow, but this wouldn't reduce milk production directly. That concludes session 6. In our next session, breastfeeding, troubleshooting not enough milk, we will focus on identifying and managing issues related to babies not getting enough milk while distinguishing between real and apparent insufficiency. We will also explore how to determine the cause and provide effective management strategies. We encourage you to share your thoughts, questions, or any topics you would like us to address in future sessions. Feel free to reach out via email at rajinder_gulati@hotmail.com. Your feedback is invaluable as we strive to create informative, helpful content. Thank you for joining us, and we look forward to continuing this journey together. Have a wonderful day.